Hello, my name is Jennifer Ranes and I am a student in the Master for Occupational Therapy at Kaiser University. I'm going to be answering some debriefing questions. How has your participation in the OTH 5853 enhanced the following? Critical reasoning. It has helped me process, understand, and expand my critical reasoning by watching different SIMU cases and videos. Also, it helped me assess different interventions and expand my clinical knowledge about different intervention process. From occupational therapy, we have watched some physical therapists providing interventions to patients, as well as occupational therapies. One of my biggest the areas that I like the most is is learning in the acute area about how to provide interventions in that area. Made me reason and problem solve a little bit more by watching those videos. Okay, problem solving through watching videos, reading, completing the assignments and the weekly logs has helped me problem solve in how to apply what I have learned and review during this class and plasma it in a paper or in a video. So basically, whenever something recently we just did by watching a movie from Temple Grandin, I was able to develop my own goals, problem solve what were the specific needs that she had, like in the areas for social skill, regulating her system, and what was the more important in order to develop those goals, and also provide interventions based on her specific needs. So that helped me problem solve. The decision making helped me make informative and sometimes quick decisions based on the assignment needs, such as demonstrate an intervention specific to the clients and leave less relevant information on the side. Again, it helps you decide sometimes what will be the most fit for an intervention, or what do you want to place in a paper in order to just let the professor know that you have understand the content. And communication, it has helped me definitely be a better communicator through videos. I feel more confident now to be able to maybe get through interviews or different clinical things that are needed by doing a video or getting in contact with a person through meetings in this way. It is still intimidating to speak in front of others sometimes, because when I have to say, I need a kind of review, and I might understand everything beforehand, but then when I have to speak, it is a little difficult to remember everything, not because of short-term spam or anything. It's just I get a little anxious to communicate what I know. So what could have been done to enhance the experience? I believe in this field, where I know that through COVID it has been so many changes. The school and you, Dr. Reyes, as a professional, have adapted the situation in order for us to have a good learning experience and be able to accomplish the MBCOT requirements. And I am very grateful for that. However, maybe honestly, to place less details. The information is good. We have a good refreshment from everything what we have learned through the year, and this expand our knowledge. However, it's way too many details, and this is just something constructive, not to rip off the program, but just to help you guys understand what the students may go, especially full-time employees, and besides other responsibilities. So maybe just taking so much of the details every week might be very helpful, and you guys might have better response from the students. The class is great, and I feel like has definitely expanded my knowledge to different multiple points touched during the whole program. What advice can you provide to a student who will participate in a simulated experience such as the one you just completed? Hello, well, if I have to give you guys, an advice will be just take tons of deep breaths. Know that most of us have been through it. We understand you, we feel you. We know that this is not easy, but if you try to plan ahead of time. It is basically like having 3 classes. Some students might take less hours, some might take only the need, and some might need even extra time. And this is not only for individuals that might have accommodations. Just by having a different language, if you guys feel like that might be a barrier, you guys definitely have to plan ahead of time. It can be very consuming. Just plan ahead of time, do your homework, be kind, respect others, and treat others just the same way you expected to be treated. And knowing that OTH 5 is also simulated experience, what are you going to do to prepare yourself for the upcoming simulated experience? We will be having a learning experience this time setting. So I am pretty excited. I haven't been one for like last 9 years when I did my CODA program. So basically I just plan to be on time, be responsible, be there for my CI, listen, learn, and be able to help. Just be able to complete this fieldwork, this second fieldwork observation, so can get to my goal, that is graduate next year as an OT. Thank you so much, Dr. Reyes.